of Surgery at Washington University. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw. Good morning, Kelly.
Good morning.
A hard story to follow.
Well, you just stick to the facts and you'll be all right.
All right.
All right, let's talk about aspirin, because aspirin is one of those interesting drugs that seems to have a lot of great medical properties.
Yeah, well, you would have to say for a drug that has been available for probably 150 years, what else can you say about aspirin? But interestingly, it's been thoroughly studied for decades, and studies literally have enrolled tens of thousands of patients. And so every few years, a very prestigious body called the U.S. Preventative Services Task Force looks at all available data for a variety of problems, and they go through that data and use very high-level statistical methods and say, what can we learn from these dozens and hundreds of studies, and then they revise their recommendations, and they do it for all sorts of things such as cancer screening and how you should treat cholesterol, etc. So recently they've come back out with who should take aspirin, and you would think that maybe everybody should take aspirin, but the data really doesn't support that, and they have a very narrow recommendation in it, specifically for individuals in their 50s, that is 50 to 59, who have about approximately a 10% chance of having a heart-related event in the next 10 years. And how would you know that? Well, you can actually go to various websites and calculate your risk for, say, a heart attack or stroke. And they said specifically these are the people that the evidence says will benefit from taking an aspirin. And as anything, there's a risk and benefit to everything. And you would say, well, what could be the risk of aspirin aside from, say, being allergic to it? But some people are on blood thinners, and aspirin could essentially exacerbate that risk, so they would be at risk for bleeding complications. So specifically, they're saying these are individuals in their 50s that have some risk of heart disease in the next 10 years, and likewise, there appears to be an effect in preventing colon cancer. So there are some benefits of aspirin, but it's probably not as broadly beneficial as once we all assumed.
All right, let's move on. This other story, I can't quite put my head around it. Using GPS data on your phones, doctor, researchers can determine infectious disease outbreaks?
Yeah, so this was, I think, a very novel and cool study. And you know, as you and all the news outlets are reporting, I mean, the world's on fire, and we are seeing human migration probably at a scope and pace that we haven't seen in literally 40 or 50 years, certainly out of the Mideast and Africa, etc. And humans are vectors, if you will, for infectious disease. And if you can understand how humans migrate, you can essentially anticipate maybe how infectious disease will break out. And you would say, well, what do we care about something that happens in the Mideast or Africa? And we've seen this affect all of us in the last year. If we think about something like Ebola or the Mideast respiratory syndrome, where it really had dramatic effects not only in the U.S. but in Korea, etc. So obviously healthcare experts are very concerned about how do you track people and how do you potentially prevent outbreaks. So they looked at this group from Harvard, looked at telephone data from Kenya, and they looked at roughly 15 million people, and they were able to, using that telephone data, track how people moved around the country, and then they matched that up, if you will, with an outbreak of a very specific infectious disease, that is rubella. And using that telephone data, they could predict with a very high, they could correlate and if not predict with a very high level of certainty how outbreaks would occur. And so I think that this is a very novel and unique way to use this data. And even if you look at a lot of these refugees from Syria and war-torn areas of the Mideast, they all have cell phones. And something obviously you could track for these kind of public health concerns.
It's really, really interesting. Dr. Bradley Freeman, Professor of Surgery at Washington University. We'll leave it there. Doctor, thanks for checking in. Have a good week.
Hey, have a great week.
825, Big 550, KTRS. Think about it for a second. But you're carrying this computer around with GPS tracking. And if, you know, okay, yes, the government knows where you are, but also doctors know where you are. So if they can figure out the patterns and back and forth and everything else, and they know where you're going, when you're going to be, and
it makes sense.
Really kind of interesting. 825, Big 550, KTRS. Stuart at Stewart's American